Everyone wants to live the American dream. Don't we all want to live long, prosperous lives, independent of others? And to be able to live is more than just luck. Some call it luck. I say no, you have to put a little effort into it. When it comes to your parents, things can change. They've given you all the opportunities they can in their life, but now it's their turn. And now that they've gotten older, there's probably some changes that will happen. We can help them live a happier, healthier life independently with dignity just by being aware and making their environment a little safer to live in. I'm going to share some things with you today that will help you give them that rewarding life of independence. First and foremost is the memory. You'll notice that the memory comes and goes for all of us. We walk in a room and why did we go in there? Well, that happens to everyone, but you may notice it a little bit differently when it comes to older folks. They may walk into a room and become anxious or upset. These are memory changes that are happening. The key is it happening because there's a problem that is medical, or is it happening because they're neglecting just daily needs? Are they drinking enough water every day? Use a little trick with them. Every time a commercial comes on the TV, when they're watching TV, take a sip of water. If they're watching birds out the window, every time a bird flies by, take a sip of water. If they're out fishing, every time they go to cast in that reel and rod, did they take a sip of water? These are all simple things that can happen. Dehydration is just apparent with everybody. Me working in the hospital, that was one of the major things that we saw come in with the older people, was that they were just simply dehydrated. It causes disorientation, confusion, anxiety, and everything in between. So reminding them to drink water first and foremost. That will assist in the memory. Also, are they eating right? Are they eating the foods that they should be eating? Not simply opening a can of soup and putting it in the microwave. Are they eating balanced meals? If they're missing certain nutrients, that too affects the mind and then also the memory. We all want to make sure that they're eating right as we are. So it's just a simple glance, and when you go to visit, do they have all the right food groups? How about their medications? Are they able to clearly read those bottles and see how they're supposed to take it and when? How about the cap? Is the cap difficult to get off where they just simply give up? They need to take a moment when they're at the pharmacy and ask for the simpler caps. They do have non-childproof caps that they can put on there that will make it much easier, especially for those that may have arthritis. It's very important that they take their medicine, but first and foremost, they have to be able to get in the bottle. The next thing that they might want to do is simply simplify their medications by putting it in a daily, weekly, or a timely organizer. And they sell these at the pharmacies, the local grocery stores, all around. Looks something like this. Very simple. All the days of the week are simply on there. They push the button, can take out just that day, and they're making sure they're only getting the 1 day of medication. If they're having a lot of difficulty, take a few minutes and fill this form when you visit them. They come in different weeks. Sometimes you can get 2 or 3 weeks or a month at a time. Makes it so much easier. Then they won't forget. Next is, are they diabetic? That's a very common problem, especially out here on the East Coast. I'm sure it is everywhere, but it's something that I've definitely noticed and seen in the hospital. Just sticking to a diet that keeps with the diabetes programs is very difficult, especially for seniors, because again, carbohydrates turn into sugars, sugars are sugars, and it's easier to make. It's simply easier and sometimes more cost effective. One thing you want to do is have them check their sugar regularly, and they can get these kits from their doctors. They stick their finger, very simple, everything comes in it, little meter, stick your finger and check this, make sure that it's within the normal range. And they can do that according to their doctor's directions, anywhere from 1 to 5 times a day is what most of them have, depending on if they're taking it in when they wake up when they go to bed and then before or after each meal. It's very important. If they're out and about and sometimes forgetful about taking their medications, they may even have times where there's sugar drops, and that can cause disorientation, also affects the memory. Simple fix to that is your local store or your pharmacy, and you can grab some glucose tablets, stick them inside their purse, carry-on bag that they might have, or even the glove box of the car. Very handy to have. If something happens, pop one in their mouth and they can come right back from it. Things like peanut butter aren't always readily available, so those pills come in handy. The next thing that we talk about is safety. When you look around their home, do they have things like throw rugs or cords or anything that has to do with electronics that they might trip over or become disoriented around? It's very, very important that you remove those things, tape them down, bring their attention to them so that they're aware of them, and try to reroute it a different way, because most trips and falls, if it ends up with any broken bones, they just don't come back from it as quickly as they should in most cases. And that's what we've seen typically, is it's things that could be avoided. So you want to kind of walk through the house. Do they use the stair rails? Do they have ample tape on the carpets to keep them down? Are there any loose carpets where they could trip? They need to get those fixed. Things like staying off the ladders without assistance. It's something they kind of have to give up. Maybe make it fun. If you have to do any of these chores, instead of making it a punishment, give me a call. I want to come help. I need to learn from you as much as you need to teach me. So going in and being present and allowing them to show you how to do it, now you've turned that around and they get to see you. What a bonus. The next thing is talking to them about their limitations and them understanding it. There are things like driving, running errands, chores around the house that may become difficult, and not always forever, just maybe for a time. And you want to take the time to be patient with them. They can become anxious and depressed over it. It is a loss of something that they cannot do, and it's a loss of their freedom. Simply humiliates them. So finding the right words and the right time to have this discussion can be difficult, but sitting down and just making it, let's talk about this and never have to talk about it again. Or let's talk about this, write down your wishes and wants and how we're going to do these things, put them in an envelope in a designated spot, and never have to talk about them until we have to use them. Writing down their thoughts about what happens if they do get injured, or what happens, heaven forbid, they end up in the hospital. Do they want a DNR, which is a do not resuscitate order? Do they want to have a living will or an advance directive that gives directions to a specific person that's designated in the family that can speak for them or make the decisions for them, or perhaps sit with the family and make the decisions together, and that person becomes the informer to the medical provider? It's very important to make some of these decisions because you can't make them after the fact, and you never know when it's going to happen. Age sometimes is not a factor, but all of us have experienced it with a family member or two, and now, as we get older, so do our parents. So we need to be aware of those things that can happen and try to prevent them. Another thing is simply them taking their own blood pressure, their own pulse ox, which is a way to make sure they're oxygenated properly in the blood, or even their own temperature. It's making sure they have these tools in their home so they can use them when it's needed. That's another thing that you never need it till you need it. And it's a good thing to have. Everybody should, truly. Very simple little kits. You can get at the store. A lot of times the doctors can give you a prescription. But these are easy devices that can most of the time be used on the arm or on the wrist. Put it on, push the button, the machine does the work for you. It's good to know when it's high or low when it comes to blood pressure, and this is one way to do it, definitely important. Should do it daily, should make a log of it. You should even make a log of what you were doing while it was high or low. That's the best way to keep track of if there is a medical problem that's happening. Another way, as I had said, is to check the pulse ox, which is a small little handheld, goes on the finger, push the button, and it gives you a reading of what your heart rate is, what your oxygen level is. Very handy tool for those that have different heart conditions or perhaps even oxygen issues, COPD, asthma, any of those things that come into play. Another very simple purchase. You can get those at most stores or order them through the doctor and have them write you a prescription. They have so many different types of thermometers nowadays. Sometimes the old-fashioned ones are just too hard to read when you're older and your eye vision is very limited. So they have all kinds of new ones nowadays. Easy ones are the ones you can pull right out, battery operated, push the button, stick it on the temple, and it gives you a reading. That's simple. Something that very important that they should have in their homes. They can keep track of their temperature. If they start to feel that there's any changes, it can be noted and given to medical professionals if necessary. The most important thing we want to do when we have these discussions with our parents is not demean them or make them feel bad about what they're doing or how they live their life. It's having them understand our concern and the need to know that they're safe and they're able to live in their environment as long as possible. Changes happen every day and it can happen at any time. So it's very important that we take the time to inform them and let them know they're loved and help them so that they can live a long and prosperous life. Hopefully these tools I gave you today are things that maybe you thought of before or maybe you hadn't, and maybe I've given you an idea. Let's all hope that it's more than just luck.